am Miriam, and I am one of the nurses here at NCLEX Bootcamp, and we're going to go over dosage calculation today. So before we get started, just to let you know, you've probably already interacted with her already. We have Courtney in the chat, and she is another one of our amazing nurses here at NCLEX Bootcamp. So she'll be moderating in the chat. She'll be putting links in for you all. And if you have any questions, just put them in there and she will get to them and answer them. And as we go through this, please put your responses in. There is a little bit of a delay with the chat box, just to let you all know. So I'll pause in between different questions as we do these problems to give you guys a chance to answer them. So if you guys do not already follow us over on NCLEX Bootcamp on our Facebook group, head on over there and join us. There's lots of students there. You can get help, answer questions, and get support from other nurses that are going through nursing school just like you. Okay, so we are going to tackle some dosage calculation questions, and there's two ways that we can go about solving this that we're going to go over, and that's going to be using dimensional analysis and ratio proportion. Who here is more of a dimensional analysis person, or are you a ratio proportion person? What's your preference, or do you not have a set preference? I definitely think that it's best to find a way that works for you and stick to it. You're just less likely to make mistakes that way. I personally am a dimensional analysis person, but we are going to go through steps for both of these. I'm going to give you some hints to help you as we go through. And you know, in practice in school, you might be given a picture of a medication label or maybe just written orders. And you could be asked to work backwards even to see if that amount of medication is drawn up in the syringe matches the given order, like if you're giving the right amount to verify. And all of these different things happen in practice too. So you should be able to move quickly between these different units and information to determine if the client's receiving the correct dose or to make sure you're drawing up the right dose for this client. So we are going to approach these in both of the two problems in these both of these ways. So dimensional analysis is going to give us kind of a standard approach. You're going to plug in all your numbers and cancel units and solve. For our ratio proportion method, this is where we're going to plug in numbers, make a proportion, and solve for X. So just keep that in mind as we go through. Okay, so first let's talk about dimensional analysis. So these are just some simple steps to help guide you with dimensional analysis. So first you need to compare what you have, and that's going to be like your med label maybe that's pictured in your question or that you're holding in your hand at the bedside. So you're going to look at what you have and then what you need or what's desired. So what are you trying to solve for? Is it how many tablets you're giving? Is it how many milligrams, how many milliliters? Maybe you just have a powdered vial in your hand and the order you need to reconstitute that medication and determine, you know, how much liquid to draw. So after you've determined what you have, what's desired, or compared that, you're going to set up your equation, and we're going to set it up so our units cancel. So I will walk you through those steps. Then you're going to multiply across, and then you're going to divide, and that's going to give you your answer. I find this a really great way to, you just write down, make sure all of the numbers they're giving you are plugged in, and it's really hard to mess up this way. Once you finish the problem, we're of course going to check our work. We want to verify, make sure we've rounded it properly. All right, so here are our steps for our ratio proportion method. So with these, you are going to identify your known and your unknown ratio. So I think of this as a relationship. We're comparing these numbers. Then you're going to set up the proportion. And remember, that's to solve for X. We cross multiply in these problems and solve for X. And then, of course, verify. Now, what's really important if you are a ratio proportion person is that you follow these rules. Otherwise, the math is not going to work for you. So you want to make sure when you set up your proportion that the units match in the numerator and in the denominator. So once you verify that, you're set to go on and cross multiply. But if they don't match, then you have to convert or just look back. Maybe somehow we've plugged something in incorrectly. The other thing that's important to understand for these ratio proportion methods are going to be that you're going to repeat steps 2 and 3 multiple times until you get to your desired units. Okay, so this is a really simple problem. that I wanted to give you all just to kind of get this practice in, to look at the dimensional analysis and the ratio proportion to kind of figure out what's going to work best for you if you don't have a preference yet. Now, this problem is one you can probably look at and solve without even plugging numbers in, but that's why I did that. I want it to be very simple to kind of just lay out the steps before we get to our two more challenging problems. So let's first look at this as dimensional analysis. So we have 1 milligram per 1 ml. Our order is 2 milligrams daily, and we need to find out how many mLs we're going to administer per day. So for dimensional analysis, we're going to put what we're looking for on the right side, and that's going to be our milliliters per day to administer. So we put that on the right. On the left side, you can put any other number there. It's just something that we have. So I'm going to start with my 1 milligram per 1 ml. Now the reason why I wrote it this way, where we're putting our milliliters on the top, is because we need to solve for our milliliters. So here we're going to put milligrams on the bottom. As I plug things in, I'm going to check them off, and that's just to make sure in a more complex problem that we've plugged everything in and not repeated anything. So the last thing we have here to plug in is our 2 milligrams per day. Now, where am I going to put that? Where am I going to put the 2 milligrams? Am I going to put it on the top or the bottom if I need it to cancel? On these problems, we need them to be opposite to cancel. So I'm going to take my 2 milligrams and put that at the top, and that's per day. So my day is on the bottom. So when we do this, we're going to now multiply across. So we get our 1 times our 2, and we get 2. And then, of course, our 1 times our 1, we get 1. So here we see that we're going to give 2 milliliters per day. Okay, let's look at this if we are approaching this from a ratio proportion standpoint. So we have our knowns and our unknowns here. So when we read this, we want to find out our comparison. What are we comparing and what are we trying to find? So as we read this, we can say 1 milligram is equal to 1 ml. That's a relationship, right? We know that that's the volume. We have one milligram in every 1 ml of this liquid. Then we know that 2 milligrams is equal to what we're trying to find out, our x mLs. So what was that step? Do you remember? We want to compare and make sure that our numerators and our denominators match. And here we have milligrams on the top and we have milliliters on the bottom. So we're going to cross multiply here, and we're going to get 1x equals 2, and we have to divide to get x alone. So we get x equals 2 mLs. Okay, so now that you've kind of seen the basis for this and how we approach these problems, we're going to get to 2 harder problems, and we'll work each of them first as dimensional analysis and then as ratio proportion. Okay, so the problem is, and these problems, this is just how it looks over on our website, where you can get a lot more dosage practice of questions just like this. So the healthcare provider has ordered 1,000 mLs of lactated ringers to be given over 8 hours. The tubing drop factor is 20 drops per ml. What is the infusion flow rate in drops per minute? And we're going to record our answer to the nearest whole number. Okay, so now that we've read this, we can take a look and find out what we need, right? And what we have, all those knowns. So the first thing I can plug in here is my ordered dose, which is that 1,000 mLs. And then we can go and find our administration time, which we see here is 8 hours. Our drop factor that's given to us is 20 drops per ml. And then what I'm looking for is going to be my drops per minute, which I can find right here to the right of my answer space. Okay, so now that I have all these numbers, we can go ahead and set up our equation. So remember, with dimensional analysis, we're going to, on the right side, put what we are trying to get to, what we're trying to find, which is going to be this drops per minute. And remember, a good rule of thumb is to check it off or mark it off as you go so you don't accidentally plug something in twice. And then over on the left, I can take any one of these numbers and plug it in, but I'll start here with my ordered dose, which is 1,000 mLs. And I already know I can put that over my time over 8 hours. And then the last thing I have to plug in is going to be this 20 drops per mil. Now I need drops on the top, that GTT. So we put it on the top per 1 ml. And so what do we see here? We see that mLs can be crossed off and we're left with drops per hour, but that's not what we're looking for, right? We're looking for drops per minute. So we can just convert here. This is where we're going to add our conversion. So we are going to put hours on the top or on the bottom if we need it to cross off. I'll give you all a second to chime in. What do you think? On the top or the bottom? So we are going to put, perfect, yes, on the top, thank you. So we'll put our 1 hour and then our 60 minutes. So here we see that our hours are going to cross off and we would be left with drops per minute. Okay, so now that we've set up our middle, we can go ahead and multiply across. So you're going to take your 1,000 times your 20 times your 1. We get 20,000, right? And then you're going to take your 8 times your 1 times your 60. And what do we get? We get 20,000 over or divided by 480, right? All right, so now that we've multiplied across, we're going to take this and we're going to divide. So what is our 20,000 divided by 480 going to give us? What do y'all get? Perfect. So I see we have a 41.6. So when you get these, you get 41 point, I think it's 66 repeating. But remember that we needed to round to the whole number, right? We're not going to give 41.6 drops per minute. So when we do that, we're going to look to the right of the decimal place here, and we see a 6, and anything above 5 or above, we're going to round up. So we are going to get 42 drops per minute. Did everybody get that? It looks like a bunch of you, so that's great. Yep, so we always want to wait and round at the end anytime you're doing any of these problems, which is especially important when you get to those ratio proportion. But here, that's just part of our last step, that verification. You can also plug the number back in and see that it works out. All right, so we all got this 42 drops per minute, and we see that that's correct. All right, so now we can do this as a ratio proportion. Now, something that helps me when I am doing a problem with ratio proportion is to plan out my steps. It just helps me to kind of know and not lose track of where I am. So the first thing we can do here is go from our hours. And again, this is the same problem, right? So we already know our knowns and our unknowns. So we're just going to plug in for our proportions. So we can take our hours and we can get to minutes. And then once we've done that, we can get our milliliters and we can get that to drops. And then we can combine them together and get our drops per minute. Okay, so now that we have our steps planned out, let's set up our equation. So with this, we know that we have 8 hours, right? And we want to know the relationship to how many minutes that is. And then our little conversion here is 1 hour, we know, is related to 60 minutes. That's the relationship. And we see that our hours are both on the top and we have minutes both on the bottom, right? So once we've done that, then we can do our cross multiplication. So you're going to get your 8 times your 60 equals 1x. So what do we get here? 8 times our 60, we're going to get that 480, right? So x equals 480 minutes. So now we have figured out our hours to minutes, and we can take on our next step here, which is going to be getting our milliliters to drops. So the next step is we need to figure out how many milliliters are related to our GTT, our drops. So we're going to put x GTT, our drops, in our relationship to 1,000 mLs. And then we know that we have 20 drops. Right here we see 20 drops per 1 ml, right? So once we have figured out that, we're verifying, of course, always verifying that our units match. So we have drops on the top and we have our mLs there listed on the bottom. So our units match. So now we can cross multiply. So you're going to get your our 1x equals 20 times 1,000. So we get our x equals 20,000. And that's drops. Okay, so now we have our 480 minutes and we know that there's 20,000 drops. So what's our next step? We have to put it together, right? So we need to figure out our drops per minute. So we're going to put our 20,000 drops over 480 minutes. Okay, so here we're going to go ahead and solve for this. We're going to divide, and you get the 42, which we should get the 41.6, right? Repeating again, in which we're going to round to 42 drops per minute. Great job. You guys are doing great, and you're so quiet, and I think that's probably because you're you're there calculating. All right, so we see that we're correct, of course, with this. Okay, so our next problem, this one is going to be a little bit more challenging. There's a lot more steps. We have a weight to convert here, but I think you all are ready for it. So we'll tackle this one first with our dimensional analysis, just like we did before, and then do our ratio proportion. And remember, don't be overwhelmed. Just take it step by step and lay everything out. So in this problem, we see that the nurse has reviewed the medication for a 7-year-old client. The nurse has had an order to administer oral acetaminophen for 60 milligrams per kilogram per day in 4 divided doses, and the client weighs 48 pounds. So we need to figure out how many tablets per dose should the nurse administer, and we're going to record using a whole number for this. Okay, so let's first take a look and find everything that we have, our knowns, our unknown. What are we looking for? So let's first look at what our given units are. So our ordered dose we see right here is this 60 milligrams per kilogram per day. And then our number of doses is given to us here. We have 4 divided doses. And then our weight is 48 pounds. And then our medication concentration, which we can see right here on this med label. So it's 160 milligrams per tablet. Okay, and then what do they want us to find out? We want to find out how many tablets we're going to give. So tabs per dose. Okay, so now that we have all of that information, we can set up the equation. Now remember, when we're setting this up, we're going to, on the right side, put what we're looking for. So we're looking for our tabs per dose. And on the left side, we can just plug in any of our numbers. Here, I'm going to start with the weight just to go ahead and get that converted. So we have 48 pounds, right? So I'm going to check that off so I don't re-plug it in anywhere. And we're going to put that over 1. And then we know what's our conversion here? How many pounds to kilograms? How many pounds are in a kilogram? I'll give you guys a second. There's a slight delay. How many pounds are in 1 kilogram? And I'm going to put perfect 2.2. And remember that we are going to put that on the top, or put our kilograms on top and our pounds on the bottom, because we need our pounds to cross off there. So 1 kilogram to 2.2 for our pounds. Okay. And then we can plug everything else in as well. So we can go we'll go to our ordered dose. So we have 60 milligrams per kilogram per day. So I'm going to put my 60 milligrams up top, and I need to put my kilograms per day down at the bottom. And that's because here we see our pounds cross off, and then we need our kilograms to cross off. So we are left here, if we just were to solve this now, we would be having milligrams per day. So not quite what we need, right? So we can take our other number here. We'll take our 4 doses per day, and we need our days to cross off. So where are we putting days? On the top or the bottom? So 4 doses per day, and we need our days to cancel. What do y'all think? Yeah, so we need our days to go on top. So we see that in one day, we're giving 4 doses. And sorry if my handwriting is kind of messy. Hopefully y'all can read this. So here we see that we'd be left with milligrams per dose. So with milligrams per dose, we then can take our last piece of information here, this 160 milligrams per tablet, and you already know what I'm going to ask. Am I putting tablets on the top or the bottom? We need our milligrams to cancel, and milligrams are currently on the top. So we're going to put milligrams on the bottom, right? So we're going to put our 160 milligrams per 1 tab. So our milligrams cancel, and we're left here with tabs per dose. You can see this one was a lot more, right? We're filling in a lot more information. So now that we have that all plugged in, let's go ahead and multiply across. So we have our 48 times our 1 times our 60 times our 1 times our 1. What do you guys get for the top? So you get 2,880. Yep. Then we're going to do the same thing at the bottom. So we'll do our 1 times our 2.2. Perfect. I see the answers coming in now. Like I said, there's a little delay. 1 times 2.2 times 1 times 4 times 160. Good job, everyone. So what do we get here on the bottom once you multiply all of that? Perfect. Yes, 1408, 1,408. Okay, so now we've multiplied across. Great job. So we've multiplied across, and now we can go ahead and divide. So when you do your 2880 divided by 1408, what is everybody getting? I already see maybe some answers going in there. So you're going to get our 2.04. Yep, so I already see you guys have rounded. So we are going to go ahead and we're going to look to the right of our decimal place, and we are going to round down. So because it's less than 5, right? So we're going to get 2 tabs here. Great job. Awesome. All right, so we can go ahead and verify this. We can plug that number in. We've already done our rounding, so we know that that's good, and we can submit our answer and see that we're correct. All right, so let's go through this one more time with our ratio proportion and plug it in for anyone that prefers that method. So first, remember, we're going to plan our steps out. So we're going to go from, we can take our pounds and we can figure out how many kilograms that is. And then we can go from milligrams, because we're given milligrams per kilogram per day, and we can figure out our milligrams per day. And then we can take that information and get to our milligrams per dose, since we know that there's 4 divided doses. And then because we have this packaging here, we can take that and then go and figure out our tabs per dose. So those are the steps we'll go in. Okay, so we already have our knowns and our unknowns, like I said, and we've already done this problem. So let's get our pounds and figure that out, pounds to kilograms. So we have 48 pounds, 48-pound child, and we want to figure out the relationship to kilograms. So we're going to put that over X kilograms. And then we know that 2.2 pounds is related to our 1 kilogram. That's the relationship. For every 1 kilogram, there's 2.2 pounds. So we're going to verify here that our units match. So we have pounds on the top and we have kilograms on the bottom. And once we've done that, we can go ahead and we can cross multiply. So you're going to get your 2.2x equals 48. And then here on our last problem, we were dividing by 1, so I didn't really call it out. But remember, you always have to divide to get x alone. So we divide by our 2.2. So you're going to get 48 divided by 2.2 and we should get X equals 21.8 kilograms, right? Great. So now that we've figured out our pounds to kilograms, we can take this information into our next step and figure out our milligrams per day. Okay, so we're going to take X milligrams, because that's what we're trying to figure out is how many milligrams we would be doing for a 21.8 kilogram child. And then we know that the relationship we have is this 60 milligrams per 1 kilogram, right? So here we're going to verify we have everything matching our milligrams on the top, and we have our kilograms on the bottom. So now we can cross multiply. So you're going to take your 60 times 21.8, and you guys can let me know what you get, 1x. So what's our 60 times our 21.8? We should get 1x equals 1308. And then, of course, just divide by 1 to get our x alone. So we know that we have x equals 1308. So this is going to tell us our milligrams. Okay. So next up, we have to figure out, we've done our pounds to kilograms, we've done our milligrams per day, and now we have to get our milligrams per dose. Okay. So we know that there's 4 divided doses, right? So we have our 1308 that we had just figured out milligrams. And we know that we're giving it that's over 4 doses, 4 divided doses. And then what we're trying to solve for is X milligrams per 1 dose. We want to know how many milligrams we're giving per dose, right? So our units match, we have our milligrams on the top and our dose on the bottom. And what are we going to do? We're going to cross multiply. So tell me what we get here. We have our 1308 times our 1, and we have 4x. Of course, we have to divide by 4 to get x alone. Whoops. Okay, and we get x equals, we should get 327 milligrams per dose. Okay, so now that we have that figured out, we have done our pounds to kilograms, our milligrams per day, our milligrams per dose, and now we have one final step to figure out our tabs per dose. Perfect. Y'all are getting it. All right, so with this last step, we knew, remember, we had that label and it told us that we had 160 milligrams per 1 tablet. So we can take our 327 milligrams and write that. And we want to know this relationship to tablets. We want to know how many tablets we're going to be giving to get that 327 milligrams. And then we are going to take what we know, this 160 milligrams per tablet. So 160 milligrams on the top per 1 tablet. So we have our milligrams on the top and we have our tablets on the bottom. Our units match, so we can go ahead and do our cross multiplication here. So you're going to take your 327 times 1 and then 160x. And then, of course, we have to divide by 160. And so what do you get here? We're going to divide to get x alone. So x equals, and you're probably getting that same like 2.04, I think it was. And remember that we have to round down, right? Because you're not going to give 0.04 of a tablet, right? That'd be crazy to try to figure out. So we wanted this whole number. So we look to the right of that decimal place, as you remember. And if it's less than 5, we're going to round down. So we have 2 tabs. And of course, we see that we're correct. So I hope that this was helpful for you all. If you're looking to find us, you can go over to bootcamp.com/NCLEX and you can see all the products we have. We have amazing cheat sheets. We have case studies. We have video walkthroughs that go with those case studies. We have readiness exams. We have a big question bank with a lot more dosage questions so you can get your practice in. And then you can also follow us on Instagram, TikTok, YouTube, and Facebook. And Courtney will be putting those links in for you all if she hasn't already. And then you can check out some of our cheat sheets are free, so you can take a look at them and download them and use them to help you studying and get ready for the board exams. So I hope you guys will come back and join us. Our next webinar is next week on the 21st at 2 p.m. Central Time. And it's Ask Me Anything with Dr. Emily. So you can get your questions ready and literally ask her anything NCLEX related and get all your questions and hear from everybody else and their common questions that they have. So thank you all for joining and thank you for sticking it out through our little technical difficulties in the beginning. It's me. I'm always the technical problem. But I hope you guys have a great rest of your day. Thanks so much for joining.